Hello, Nandu. Good evening, Joe. So, is the entire screen visible? Okay. Madhulata, Madhu. So, Joe and trying. Okay. So, almost 3 members join now. So, is the audio and video clear, ma? Audio and video, everything clear?
Yes, madam.
Okay. Thanks for the confirmation. Okay. So, good evening, everyone. Welcome to Healthcare Hub. So, this is the second session, paid session at Google Meet. This is a warm welcome from Healthcare Hub channel. So, first session we have already covered about medical and surgical nursing, 30 bullet points, and this is a second session. So, I am senior nursing officer at Hyderabad, and today we will be seeing about drug dosage calculation, and also we will be seeing about this IV fluid calculation, IV fluid calculation formulas also. So, we will be seeing both drug dosage calculation and also IV fluid. Three methods of calculation is there, and we will be learning each and everything with examples. And whether you want to continue with the class, continue this class in English or Telugu or in both language. So, which one is comfortable? Are you unable to send any message? Are you able to message in the group? Just send me the message confirmation. Okay, so you are able to message in the group, right? Okay. So, when we are going to learn this drug dosage medication, we are also supposed to know about the 10 rights of medication administration. And shall I continue in English itself, or can I use Telugu also in between? So, total 10 rights of medication administration is there. So, the first one is right drug. So, whenever we are selecting selecting this medication, we are supposed to use the right drug. Instead of amoxicillin, we cannot use ampicillin or any other drug with the same sound. Okay, right patient. Sometimes we will be having same patient. For example, Satyanarayana patient. If two patients are there with the same name as Satyanarayana, why people have left now? If two Satyanarayana patients are there, better we will call the patients with their father's name or the mother's name. Okay, two patients can be with the same name and same initial, but their parents' name will not definitely will match. So, right patient we have to find out, and the right dose. Whenever we are giving, for example, tablet Atrovas, it is available in 10 mg, but in the case sheet it is written as 40 mg. So, how many tablets we will be giving? If it is 10 mg and 40 mg it is advised. So, how many tablets we will be giving? So, whatever answer you want to give, just give in the comment box so that I can see and I will come to know whether you are answering correctly or not. So, right dose is how much of amount or how much of amount of administration we will be giving. So, Atrovas 40 mg means we will be giving around 4 tablets. Right route, right time and right frequency. Right route is sometimes few medications will be given through oral route. Some medication will be giving through intramuscular, or some will be given through parenteral route. What is parenteral? So the meaning of parenteral means, par means not just bypassing the GI tract away from the gastrointestinal system. Parenteral method means that is through IV injection, intramuscular, intradermal. So different routes of medication there, except this oral route or except this dulcolic suppository rectum route, only through injections if it is given, that is called as the parenteral route. And administration of medication should be done at the right time. If it is a morning dose, BD, OD, TID. OD means once in a day, BD means twice a day, TID thrice a day, QID means 4 times a day, Q6H means every 6th hourly. If it is written in the case sheet as QCH or Q2H, temperature monitoring. Ma'am, video is not visible. Means my video or the screen? Is it not visible to everyone or one person alone? Jhansi, Janu is saying, rest of the members, meeta valki screen kanpistunda? For me visible, okay. Jhansi, Janu, once you means log out and again you join so that it will be visible, okay. So sometimes it is written in the case sheet as every 2nd hourly, every 4th hourly. Either it can be temperature monitoring or BP monitoring. Here we are talking about the medicines. So medicines they will be writing like nebulization, Duolin plus Budocort, every 4th hourly, like that they will write. So right dose, right time and frequency. Frequency means how many times you are going to give that medication to the patient. And right documentation. So what is right documentation? Whatever medication you are giving by yourself. Sometimes medicines మీరు ఏదైతే లోడ్ చేస్తున్నారు, if for example ceftriaxone or monosef injection మీరు లోడ్ చేస్తున్నారు, లోడ్ చేసిన తర్వాత instead of you administering that particular medication, you are giving it to somebody else, means your friend or colleague who is also working along and asking them to give the medication. Sometimes medication error may also happen. So once you load the medication, you should dilute it and you should administer it and you should document it. Means for example, I am giving tablet paracetamol, right? Paracetamol I am giving, and while documentation what I am doing, I am writing it as tablet dolo. Whether this is a right or wrong method? This is completely wrong method. Whatever drug you have administered to the patient, the same has to be documented. Understood? Then right history and assessment. Right history and assessment is few people have medical reaction to certain drugs. Some people allergic reaction to paracetamol. So before itself we are supposed to know the history of that particular person. Usually whenever మనకి ఏదైనా పేషెంట్ వచ్చినప్పుడు మనం ఏం చేస్తాం, history collection and physical examination we do, right? So once we do history collection and physical examination, in the history we are supposed to know what and all food allergy, drug allergy, any seafood allergy. For example, if we are performing this cardiac catheterization, whether he is having this seafood allergy or this iodine allergy, all these things has to be found out in the right history and assessment. Then right drug approach and right to refuse. So if the patient is saying I don't want to get dulcolic suppository, means you are not supposed to give. You cannot force the patient. Doctor చెప్పారు మీకు డల్కోలిక్ సపోజిటరీ పెట్టుకోవాలి, డాక్టర్ చెప్పారు మీకు ఎసెక్లో ప్లస్ పీసీఎం ఇప్పుడే తీసుకోవాలి అని చెప్పేసి, so like that you cannot force the patient. If the patient has refused the drug, then definitely they have the right to refuse that particular drug. Is it clear? Then when you look at the nursing responsibilities, just now I have told, no? So right drug, right patient, right dose, right route, that is IV, subcutaneous, intramuscular, everything has to be noted down. When coming to the right dose, or sometimes in right drug we have this problem of look-alike medications. Can I see this image here? Look-alike medicines. Look-alike medicines means, see here it is phenylephrine and neostigmine. Once you look at this image, you will know, okay, both look similar, but both are two different drugs. So these are called as look-alike medication. So whenever we are administering this medication during drug dosage calculation, we have to look the vial properly. 3 checks you have to make it compulsory, then only we are supposed to administer. So, this is a look-alike medication. Here look at this medicine. One is ampicillin and other is amoxicillin, right. So, ampicillin, if the prescribed medicine is amoxicillin, we cannot administer ampicillin for the child, right. So, whichever is prescribed, that only we have to administer. These are called as look-alike and look-alike drugs. Same way this ondansetron and vasopressin. Ondansetron is a anti-emetic drug, whereas vasopressin is an anti-diuretic drug. It is a diuretic drug, right. So, these two look similar, but these two drugs are not supposed to be given. Whatever their medicine is prescribed, if they are prescribing injection Jofer, then we are supposed to give this medicine. If they are asking vasopressin, then according to that we have to give. Then these are called as sound alike drugs, look alike and sound alike drugs. Sound alike drugs means, see, alprazolam and lorazepam, they sound alike. Then Cardin, Cardura, Flomax, Fosamax, see, they both sound similar, but these are two different drugs. Lamisil, Lomotil, Nizorol, Neorol, Plendil, Prelos, Zantac and Zyrtec. So, these are called as sound alike drugs. So, never confuse yourself whenever you are administering their medications. And coming to this drug dosage calculation, we have three systems of measurement. So, what are the three systems? The first one here is the metric measurement, and the second one is the apothecaries system, which is a very old method of calculating the medicines, and the third one is household system. Okay. If you look at this metric system, so this metric system is grams, weights, meter or liter. So, this is called as the metric system, where we will document the medicine in grams, milligrams, in meter, or in, if it is in length, we are going to meter, kilometer. This is called as what? This is called as the metric system. If it is available in liters, so milliliters, liters, deciliters, that is how we are going to monitor. So, this particular way of documenting is called as the metric system of calculation. One second. Is the screen visible to everyone? Whether the Jhansi has joined? Now screen is visible? Okay. So, three systems are there. The metric system I already have told you, gram, meter, liter, everything comes under metric system. And this apothecary system is grain system, which is a very old method of documenting. Right now we are not using it because it is like grain, GR 1/4, GR 2, like that they will write. It is a Roman numerical method, and this is the very oldest measurement method. Then the household system. See, household system is whenever we are whenever you are cooking anything, so how we will measure in drops or spoons, teaspoon, tablespoon, like that we measure, right? That is called as the household method. Household method is drops, teaspoon, tablespoon, cups, pint and glasses. This is a household method of drug dosage calculation. Then other system of measurement is, one is milli equivalent. So, whenever we are documenting this milli equivalence like serum sodium, for example, serum sodium will be documenting as 135 to 145 milli equivalents per liter. If it is potassium, we will be documenting as 3.5 to 5.5, or sodium bicarbonate like milliequivalents per liter, this is how we are going to monitor, that is called as milliequivalent. Then units, units is for example doctor will write okay 220 grams per deciliter. This is metric system. I have documented the patient sugars, GRBS. So how much insulin I will give? I will be like insulin high means human ectopid injection 8 units given subcutaneously, like that I will sign in the last. Understood? So here how I have written 8 units, that is called the unit method of documenting. So in this documentation method we can either write for medicines like insulin, penicillin or heparin sodium. So whenever writing we are this kind of medicines, we are going to use units. Understood? Then in the metric system, see I have metric system already have told you the measurements like grams, kilograms, like that. For example, how we will write 1 gram? 1 gram can also be written as 1000 milligrams, or 1 gram is equal to 1000 milligrams. 1 kg, how we can write? 1 kg or 1000 grams, or 1 kg is equal to 2.2 lbs, or 1 milliliter is equal to 0.001. So this is a metric system. When we are writing, for example, I am writing okay 1 mg of tablet, what tablets shall I say, okay, Atrovas, 1 mg of Atrovas I have written. Otherwise I can what I can write, instead of 1 mg I can also write it as 0.00, here it is there na, here. So I can also write as 0.0001 gram of tablet Atrovas. We can write in both way. Understood? So this is the metric system and this is the equivalent value. Like that, metric system and apothecary system, I have told you know, this is the old method, Roman method, which we are not following right now, apothecary system. Then household method, teaspoon, tablespoon, 1 ounce or 1 cup. So 1 teaspoon is equal to how much? It is equal to 5 ml or 16 drops. Drops we can also call it as gutta. Understood? So it's a Latin term. Instead of drops we can also call it as gutta or GTT. GTT. Understood? So 1 pint we can write it as 16 fluid ounce or 480 ml. 1 quart is equal to 2 pints or 946 ml or 32 fluid ounce. So this is a household method. Then household method, other things are like 1 pound. In India we usually tell what, in India usually we call it in kilos. For example, if any human being in India we call what is your weight, we will tell like 70 kgs or 50 kgs. But in other countries and all they say it is in pounds. We call it as kgs. Whether other countries they call in the form of pound. So 1 kg is equal to 2.2 pounds, right? If the patient is 50 kg, so 50 kg is 2.2 pounds. So how we are going to make it into pounds? 50 into 2.2. 50 into 2.2, 2 zeros are 0, 2 5s are 10, 2 zeros are 0, 2 5s are 10. So finally what we will get, this amount we will get. So here point is there, so it is around 110 pounds. Understood? Understood? Are you there, all of you? Listening? Girls and boys who are online is there, are you listening? Confirm once. Okay, thanks for the confirmation, Pavitra. Okay, So when we are giving this medication, we should also think of intake and output chart. So in intake and output chart, what we will document? Usually in IO chart, we will be writing the patient oral route, then through IV route what he has taken, or through injection route what it was given. Then output we will be going to write the drain what has come out, the urine output, or the stool if he has passed, everything comes under the output. In intake we will write as water, juice, milk, soup, anything. అంటే నోటి ద్వారా ఏదైతే తీసుకున్నాడో అవన్నీ ఇంటేక్ కింద వస్తాయి. సో ఆ లిక్విడ్స్ ఫుడ్స్ అనేది లైక్ ఐస్ క్రీమ్, జెలాటిన్, కస్టర్డ్, ఇవన్నీ intake and output chart lo manam document cheyalsi untundi. See, this is all these things are intake. In intake we are going to write, for example, Ryle's tube feeding or jejunostomy feeding, everything comes under this parenteral route. This is feeding and all comes under in the intake, like any oral fluids, soups, water or milk, or any jejunostomy feeding we are giving, all this comes under this intake chart, right? Then output means, in output we will be mainly documenting the urine, stools, or if the patient has vomited, the vomitous amount and the bladder irrigation if we have done. So all these things we have to document. In the catheter, in the uro bag, if any urine is collected in the uro bag, we have to document that. Then wound drains, wound drains will be available na. So in the wound drains, how much of wound drain was collected, whether it is 100 ml in 24 hours or 50 ml in 24 hours. So in the output we are going to document all these things. Understood? Okay. Sometimes doctors won't prescribe the amount whatever is available in the ward. They will be prescribing like for example we have 1.2 grams of augmentin we have. What they will prescribe, they will write as 600 mg IV injection augmentin they will write, right? So we need to convert them into the prescribed value, we need to convert them into that particular value and only we are going to administer. So common conversions in healthcare, especially in hospital settings, will be like pounds to kilos, milligrams to grains, minims to drops. Like that we are going to convert and we are going to administer the medication. Then let's start the calculation. So this is the standard method of calculating of drugs. So the first one is D. D stands for desired dose or dose ordered by the primary care provider. So desired dose or dose ordered by the, so whatever the doctor is ordering, like he may order 500 mg of PCM or 650 mg of Dolo, but you have only 500 mg of Dolo. For example, you think for 500 mg Dolo only is available. So whether you need to convert into the prescribed dose will be like, so the prescribed dose will be 650. Understood or not? So D stands for the desired dose or whatever the doctor is ordering, that is called as D. Then H. H is available dose which is available in hand. It can be available dose on the label of bottle. It can be vial or ampule. So the dose which is available in hand is called as H. It can be vial or ampule. V. V means vehicle or the form in which the drug comes, that is it can be tablet or liquid. So V can be tablet or liquid. So remember these three terms very clearly, D, H and V. V is what the doctor is ordering. H is which is dose available at you. It can be vial or it can be ampule. Then V stands for tablet or liquid. Understood? So these three terminologies are essential to understand the problem. We will look into the first problem now. So the formula can be written as So formula is D into V by H is equal to amount to administer. So this is the amount to administer. So understood the formula, ma? D into V by H is equal to amount to administer. So here we exactly don't know what will be the amount we are going to administer. So that formula can be written as H is to V by D is to X. Here X stands for, we exactly don't know the how much amount is being prescribed. Understood? So this can also be written as H by V is equal to D by X. Clear? See, whatever that formula I have told you now, H by V, that is H is to V, D is to X, or it can also be written as H by V or D by X. Let's solve one by one. And the girls who are available online, please take a white pen and paper so that you can solve and you can also answer me online. ఎవరైతే ఆన్లైన్లో ఉన్నారో నేను చెప్తుంటాను, మీరు దాన్ని ఆన్సర్ చేస్తూ ఉండాలి, సరేనా? So here let's start the first question here. Okay. Whether you will answer, girls? Let me know, girls, are you going to answer this question? So here the doctor has ordered how much? 750 mg the doctor has asked, ordered erythromycin 750 mg to be given to the patient. But erythromycin, how much is available with you in the ward? It is around 250 mg, right? So what is the formula? So desired dose here is, desired is D is equal to 750. On hand which is available, H, is 250 and it is available in capsule form. So vehicle V, the vehicle V is equal to 1 capsule. So what is the formula? We have already discussed now. H is to V is equal to D is to X. So what is the H value here? So here we have the H value 250, right? The H value is 250 and this H is to, one second, it can also be written as H by V is equal to D by X. So the H value is how much? It is around 250 and the V value is how much? 1 and the desired dose they are asked is 750 and we don't know the value of X here. So what we are going to do? We are going to cross multiply this one. So X is equal to 750 by 250. So 0, 0, 0, 0, you are going to strike it out. So 5 5s are 25, 5 1s are 5, 5 5s are 25, then 5 3s are 15. So 3 capsules. So we have 250 mg in hand. So the doctor has ordered 750 mg. We are going to give 3 capsules to the patient. Whether it is clear to you, online people, are you able to understand? Okay. Fractional equation method, just now I have told you, that is H by V is equal to D by X. Then one more. So here the ordered dose is 0.25. So the ordered dose is 0.25 and the ordered which is available in hand is 0.125 mg tablet. So one tablet is 0.125 mg. So the desired is 0.25, on hand available is 0.125 and the vehicle it is available in 1 tablet. So how we are going to write that one? 0.125 by 1 is equal to 0.25 by x. We are going to cross multiply this, and after cross multiply we are going to get 0.125 by 0.25. So, if you calculate this one, you are going to get around 0.5. So, it means 2 tablets has to be given. Understood? So, the answer is 2. Clear? Is it clear or not? If you want me to explain one more time, I will explain one more time. Because math calculations, sometimes the nurses really face difficulties when they are having this calculation method and all. So, if you are having any difficulties, please let me know. One more time, this one, huh? Okay, the second question you are asking, Pavitra, right? Okay, one more time I will explain. One more time, ma'am, how 0.5 become? See, one tablet dose is 0.125, right? So, 1.25, 1.25. 1 tablet is okay, 1 tablet is 0. On hand we have 0.2125 and tablet is 0.125. okay. So 125 is it is around 0.250. Let me, okay, 0.125 by 0.25. Okay, 5 5s are 25, 5 2s are 10, 5 5s are 25 and 5. So, we are going to get 0.5 here. So, 0.5 into 0.5 we will be getting, but here the answer is 2 tablets, right? So, desired dose is 0.25 mg. So, the doctor has asked here, so the doctor has asked here 0.25, but the answer we got is 0.5. So, around if we give 2 tablets also, it will come around 250. Desired dose by available dose, ma'am. Okay, desired dose by available dose. Desired dose by available dose. So, desired dose is got it, Pavitra? Okay, we will go with the next question. Okay, now we will see how to calculate the IV fluid flow rate. To calculate the IV fluid flow rate, we should also know the total volume of the fluid to be infused for the specific time for the infusion. Sometimes we will be keeping the IV fluids, we will be using these electronic methods to give or IV fluids like normal saline, ringer lactate, dextrose in 5% water or dextrose in 25% of water, right? NSRL, D5W or 25D or mannitol. So, these are different types of fluids, and sometimes when the patients are in ICUs, so in ICU how they will be like connect syringe pump, give fentanyl plus midas, like that they will be telling. So, what we will do, we take 2 ampoules of fentanyl and 25 ml of 25 ml of this midas. So, we will be diluting and we will keep in the syringe pump. So, these are the electrical methods of keeping. Or sometimes in fluids we will also keep this blood transfusion, platelet transfusion, fresh frozen plasma transfusion or plasma transfusion. So, all these things comes under this IV fluids transfusion, and it has to be calculated and it has to be given to the patient. Few medications we can give, just dilute and we will give, right? But Other medications we have to calculate and it has to be administered very slowly. For example, calcium gluconate or magnesium sulfate, this has to be given very slowly. Whenever we give this magnesium sulfate, the patient will have this complaints of like hot flashes on their face. So, we need to calculate according to the physician, then only we are going to administer. So, there are three common methods of administering the flow rates. So, one is ml per hour and the other one is drops per minute. Listen carefully. So, one is we are going to give how many ml can be given in an hour, in 1 hour, and here is how many drops can be given in 1 minute, and the third one is infusion time. What is the meaning of this infusion time? Infusion time is in how many hours we are going to administer the medication. Understood? So, first one is ml per hour, second one is drops per minute, third one is infusion time. Understood? So, we can also write drops per minute as also we can write it as GTTS per minute. GTT means, what is the meaning of GTT? GTT means drops. Okay, thanks for the confirmation, Pavitra. Denominator and numerator I have made wrong. Okay, yeah, that's the reason. Okay, then drop factor, sometimes we also consider this drop factor. So, in the drop factor, we must also learn about this macro drop and micro drops, micro drip set. So, in the macro drop set, it is available in 10, 12, 15 and 20 drops per ml. So, 1 ml can be either 10 drops, 12 drops or 15 or 20 drops. This is in macro drop set. Whereas the micro drop set, it is 60 drops in 1 ml. So, this macro drop set usually we will be using in adults, whereas the micro drop set we will be using in infants and children. Now, you people have to answer me how you will differentiate the macro drop set and micro drop set just by looking. Just by looking the IV set, without just by looking at the set, you have to tell me which one is macro and which one is micro. How? What is the best method to find out which one is a micro and which one is a macro? Let me know. I want to listen from you. Tell me. Josas has left. So, how we will find out which one is a macro and which one is micro drop set? Just by looking at the image. See, here the macro drop set, here you can see, here it is in the form of, I think based on readings. See, here the pin model, in the micro drop set, the inside that drip chamber, this is the drip chamber, right? So, this is called as the drip chamber and this is called as spike, right? So, this is the spike here and this is the drip chamber. Inside the drip chamber, if you look, see, this will be in so, here it will be in a small pin type model, whereas the macro one you will find a big plastic type, it will be like this. Macro one will be like this inside the drip chamber, whereas the micro one you will have a small pin type model. So, in this pin type model we are going to have this drops. So, children how much? Micro drip how much? 60. Micro is 60. Remember 60 GTT per ml, whereas the macro is 10 to 20 GTT per ml. In exam, you may get questions on this. Then, so now we will learn about the drops per minute, how we are going to calculate the formula for calculating drops per minute. So the formula here is drops per minute is total infusion volume into drip factor by total time of infusion in minutes. Understood? So total infusion volume into drip factor by time in minutes, we are going to calculate the formula. Remember the formula? Using this formula only we are going to solve. Understood? So look at the question here. A patient is receiving 250 ml of normal saline IV for how many hours? 4 hours. Right? 250 ml of normal saline for 250 ml for 4 hours. So using tubing with a drip factor, just now I had told na, drip factor is 10 drops per ml. So how many drops per minute should be delivered? So how many drops will be delivered? So here they have already given total infusion volume is 250 ml, right? And the drip factor is around 10, and total hours is minutes. We have to convert into, here we have already told total time of infusion in minutes. Here we have got value in 4 hours. So 4 hours, how we can convert into minutes? 4 into 60, right? So we will get how much? 240. So what we are going to do? We are going to strike it 0 to 0. Then 250 divided by 24. So what we are going to do? 240 by 240 tens are 240. So what value we will get? We will get a value of 10. Then put a point here. After putting point, we can make it as 100. So what we are going to do? 24 fours are. 24 fours are how much? It is 96. So once you minus, how much you are going to get? 100 minus 96, you are going to get 4. Then already we have point here. So what we are going to make? We are going to make it as a 40. So the value will be like 10.4, or round figure we can tell it as 10 GTTS per minute. So this is a round value. Is it clear now for you? Have I made this clear? The total infusion volume is clear. Okay. 250 into 10 drop factor, and minutes we have hours we have converted into minutes. We have striked out 250 divided by 4, we got the value, that is 10.4 GTT or 10 drops per minute. Understood? This is calculating for minute. Next question. Next we will learn about formula for calculating milliliters per hour. Formula for calculating milliliters per hour. So for calculating, what is the formula? Total infusion volume in ml by total infusion time in hours. Here it is in ml and bottom is in hours. So here the question is like, your patient needs 2000 ml of saline IV for 4 hours. So here they have mentioned 2000 ml saline over 4 hours with deficit fluid volume. Deficit I have already known, diarrhea, vomiting, drain. So like that the patient has fluid deficit volume. So how many milliliters per hour will you set on a controller? So per hour, how many milliliters will you give? That is the question. So here we already have the total infusion volume. How much? 2000 we have infusion volume, and here already they have asked in hours. So directly we can put by 4, right? So we can strike it off. 4 5s are 20. So we can write it as 500 ml per hour. Clear? Clear, all of you? Those who are online, it is clear? పవిత్రతో పాటు ఇంకెవరెవరు ఉన్నారు? ఝాన్సీ, అదర్స్, మధులత, one is Madhulata, M Pavitra, Nandu. So totally only 1 2 3 members are there. Others, respond in the group so that we can continue. Okay, now formula for infusion in time. So how many hours we can administer? Clear. Okay, thanks for the confirmation, Pavitra. Good girl. Okay, now we are going to find out the how many hours we have to infuse. So the infusion time is in hours is equal to total volume to infuse in ml by milliliters per hour. So the formula is total volume to infuse in ml by milliliter in hour. So here the question is, a patient is ordered to receive 1000 ml of normal saline solution at the rate of 125 ml per hour. So here the doctor has asked 1000 ml of, means one fluid bottle is 500 ml. So 2 fluid bottles of normal saline administered at the rate of 125 ml per hour. So how many hours will pass before you change the IV bag? So how many hours will be there? So total volume to infuse is how much? So according to this formula, total volume is 1000, right? And how much to be infused? Ml per hour they have already given, that is 125 they have already given. So both we can cancel in the 5 table. 5 2s are 10, 5 5s are 25. 5 2s are 10, 5 0s are 0, 5 5s are 25, 5 4s are 20, 5 0s are 0, 5 8s are 40. So the answer will be 8 hours. Clear? So around how much time it will take to pass before you change the IV bag? Around 8 hours will take if we are transfusing 1000 ml of normal saline at the rate of 125 ml per hour. Clear? Any doubts? Now we will go with the real calculation. Okay, so this is the first question. Okay, so here the question is a healthcare provider. So here the question is a healthcare provider prescribes 1500 ml of normal saline to be infused for how many hours? 7 hours, and the drop factor is 15 drops per ml. The nurse should set the flow rate of IV infusion pump per how many ml per hour? Ma, is the screen visible? So how many ml per hour and how many drops per minute? Here the question is how much you will infuse within 1 hour and how many drops you will give within 1 minute. The question. See, here we have the formula. We have the formula. So how many ml per hour? That is total infusion volume in ml by total infusion time in hours, right? So here the question was about 1500 ml. So 1500 ml within how much time it should be given? So 1500 ml, it should be given within 7 hours, right? Already we have V in the form of ml and T hours in the form of 7 hours. So what we are going to do, 1500 divided by 7. So what we are going to do, 7 2s are 14, and how much we are going to get, right? One second, one second. Okay. So then, okay. So 1500 divided by 7, 7 2s are 14, then again we will put this. My pen is not writing here, ma. So 7 ones are 7, then again from 10 if we minus we are going to get 30, then 7 fours are 28, then how much we are going to get? So how much we are going to get? 2 here, then we put a point and we will drop a 0 here, and 7 2s are 14, 7 3s are 21, so 7 2s are 14. So we are going to get a value of 214. So how much we are going to get a value here? That is 1500 divided by 7, we are going to get 214.3 ml per hour. So here we have got value for how much? Here we have got value for, that is 214 ml per hour, and they have also asked how many drops will you give within a minute. For that again we have to convert. So again how we are going to convert? Minute factor I have already told now the formula. So same 1500 ml, and they have asked us for 7 hours. 7 into 60, how much we are going to get? 7 into 60 we are going to get 420 into, here drop factor is 15 drops per ml. So once we multiply this 1500 into 15 by 420, we will get the value. No, okay. Now the calculator is visible. 1500 into 15 is equal to 22,500, which we will divide with 420. So how much we are going to get? We are going to get 53 drops per minute. So once we convert into minutes, we are going to get a 53 drops per minute. Clear, ma? Okay. So understood now? Okay, next we will go with another question. Second question. So the second question is, a healthcare provider prescribes 1200 ml of 0.5%, means half NS or 0.45. Usually full NS is 0.9%. Half NS is how much? 0.45% is, we call it as half NS. So healthcare provider 1200 ml of 0.4% of normal saline to be infused at the rate of 125 ml per hour, and the drop factor also they have given, and the drop factor is 12 drops per minute. How many drops per minute should the nurse adjust the flow rate to safely administer the prescribed intravenous solution? So the formula here is, how to calculate the drops per minute is, that is total infusion volume into drop factor by total time of infusion in minutes. So here they have already given the value of 1200 ml into drop factor is 12, and here they were asked how many hours here, 125 ml per hour, and the flow rate should be administered so here they have not mentioned the timings. So what we are supposed to do when they have not mentioned the timings, what we are going to do, 1200 ml divided by, we are going to write it as 125, right? So once we calculate this one, 5 2s are 10, 5 5s are 25, 5 2s are 10, 5 4s are 20, 5 5s are 25, 5 4s are 20, 5 8s are 40. So around we are going to get, once this 48 is divided by 5, we are going to get a value of 9.6. We are going to get a value of this pen. Small problem with my pen here. So here we are going to get for around 9 hours. So once you divide this value, we are going to get 9.6 hours. If you want to convert this 9.6 hours into minutes, we are going to get how many minutes? 9.6 hours is nothing but 9.6 into 60, we are going to get around 576 minutes we are going to get. 576. So using calculator, we can calculate this one. 1200 into 12 is equal to 14,400, which can be divided by 576. We are going to get a value of 25 drops per minute. So this is the answer. Okay. So this is about the second question. Next, the third question. I'll finish it off. So the third question is, a nurse was assigned to a medical surgical ward for a 30-year-old female client diagnosed with the patient has pneumonia. See, when they are asking questions, they may confuse with you patient age, thus to distract you away from the question. Telling that the patient has diagnosis of pneumonia, the patient is 30 years old, medical surgical ward or MSW, like that they will tell you. But this is only to distract you. Here we are going to focus only on the question part, main question, what they are actually asking. So the patient primary healthcare provider prescribed 250 ml of 5% dextrose in water, 5% dextrose in water to be infused for 2 hours and 45 minutes, and the drop factor is 60 drops per ml. Drop factor is 60 drops per ml. To safely administer the prescribed IV solution, the nurse should regulate the IV pump. IV pump can be syringe pump ma. So IV pump, how many drops per minute, additionally compute for how many ml per hour. So here the question is about how much you are going to administer drops per minute and how many ml per hour. And also there is one question, if the infusion is set on 15.00 means at 3 o'clock, right, and the nurse should expect the solution to be at what time. Write your answer using 24 hours format. They have asked 24 hours format you have to use and tell within how much time you are going to finish it off. They have already mentioned 2 hour plus 45 minutes. So if you add for this time 3 o'clock, it will be around in 24 hour format how much, 15, 16, 17. So first answer we have already got 17:45 means 13, 14, 15, 16, 17 means it is around 5:45 p.m. it is going to get over. One question we already got, the rest two questions we will focus now. So here the question is about 250 ml of dextrose 5% in water, right? That is 250 by 2 hours. So they have mentioned 2 hours 45 minutes. So 2 hours 45 minutes means 2 into 60 plus 45. So how much it will be? 120 plus 45, that is around 165. And drop factor they have mentioned 60 drops here. So better to multiply two numerators and we will divide it by the denominator. So let me calculate here. 250 into 60 is equal to 15,000. It is divided by 165 and you will get a rate of around 90. So answer is 90. 90.9 or 91 GTT per ml. Here we have got 90.9 approximately, but we are giving a correct value here, that is 91 drops per minute. And they have also asked question, how many ml you will give in 1 hour. So how we are going to calculate? 250 ml by hours we have to write. Hours is how much? 2 hours 45 minutes. So how 2 hours 45 minutes means we can't write 45 here. So better to convert, dividing 45 by 60 means 45 divided by 60 you will get 0.75, right. So what we can write here? 250 divided by 2.75, we will get the value. 250 divided by 2.75. So that is 90.9 or 91 ml per hour. Am I confusing you? All of you? Am I confusing you? Are you able to understand? So according to the question, here we have got the answer 91 drops per minute and 91 ml per hour, and it will be finished by 17:45 is nothing but 5:45 it will be finished. That is 2 hours plus 45 minutes. They have asked the question in 24 hours format. Clear all of you? Okay. ఉన్నారా అమ్మా లేకపోతే పారిపోయారా నా దెబ్బకి? Okay, now this question you people do ma. Okay, now you have to answer, those who are online. So here the question is, a healthcare provider orders infusion of 2750 ml of 0.5 normal saline to be given 150 ml per hour, and the drop factor is 15 drops per ml. The nurse will set the flow rate for how many drops per minute to safely administer the IV solution. So this is the question. So how you are going to infuse? So here they have given around 150 drops per minute within 1 hour or 60 minutes they have given. Drop factor is 15. Now you people tell me the answer then. Those who are online, kindly answer. 150 divided by 60 into 15 GTT, that is 15 drop is the drop factor. So what will be the answer? Tell me. I am waiting for you. I will, once you answer this question, we will finish it off this session. Okay. Exactly, Pavitra. Very good, Pavitra. So, how much we will get? That is 150 into 15, we will get 2250, which is divided by 60, we will get around 37.5, or round figure we can write how much? We can write 38 GTT per minute. So Pavitra, you have told correctly. Very good, Pavitra. Okay, shall we finish it off? That's it. Okay, that's all for today. So we have finished this much. Okay, day after tomorrow again we will meet up and we will discuss the other questions later. Anything you want to talk? Is there anything? Anything? Next topic? Okay, next topic, what you want me to take? Fundamental important things. See, in most of the time in exam they will be covering topics like medical and surgical nursing, and this fundamentals of nursing is the basic for everything. So I am planning to take more of this fundamental related questions next time. So ESI is very near, yes I know, that's why I am planning next FON we will brush up all the good topics next class, day after tomorrow. Okay na Pavitra? Pavitra, where are you from? Where are you from? Which place? adonium, where it is adonia, okay, okay. అంటే గుంటూరు దగ్గర కదా ఇది, తెలుగేనా? ఓకే, గుడ్. ఎస్ఐ ఈజ్ వెరీ వెరీ నియర్. ఎఫ్ఓఎన్ మంచి మంచి టాపిక్స్ నెక్స్ట్ టైం కవర్ చేస్తాను. సోరెన్, వెదర్ దిస్ సెషన్ ఈజ్ యూస్ఫుల్ టు యూ? మెంబర్స్ హు ఆర్ ఆన్లైన్, పవిత్ర కాకుండా ఇంకెవరెవరు ఉన్నారో ఆన్లైన్లో అందరు రెస్పాండ్ అవ్వండి. ఐ రియలీ వాంట్ టు లిసన్ ఫ్రమ్ యూ ఆల్సో. Okay then, I'll wind up this session. Okay, bye bye bye. Take care. Prepare well. Thank you, Nandu. Bye bye.